Many of us have experienced shoulder pain from time to time. I know I have, but what about extreme pain from a rotator cuff injury? You know, they become more common as you age, and you want to make sure you're getting the help you need to prevent further discomfort. So joining us today is Dr. J. Dr. J, thank you so much for coming on back.
Nice to see you again. Thank you.
We're very happy to see you.
Likewise.
And he is with our Hawai'i Shoulder and Orthopedic Institute. He specializes in this area of expertise. Now, Dr. J, before we kind of get into the injury itself, let's go ahead and talk about the area that these injuries are taking place. What is the rotator cuff and where is it at specifically on the body?
So the rotator cuff is a group of 4 muscles, and they envelop the capsule of the shoulder. The shoulder is a very special joint that it has a very large range of motion, and at the same time great power. And deep to the big muscles, you have the 4 small muscles that basically surround the capsule. They call the supraspinatus, infraspinatus, teres minor, and subscapularis. And what those muscles do is when you initiate shoulder motion, they contract and they help stabilize the joint.
But when it's not working well, when you're getting a little older and you're doing repetitive overhead motions, what can happen?
So what can happen is you can have different types of pathologies. You can have anything from impingement, where basically the muscles are getting squeezed between the top arch of the bony shoulder and the humeral head, and that happens usually when you're doing overhead activities. So patients usually with rotator cuff discomfort, they have more discomfort when they're doing overhead, but when they're doing counter-level activities, they don't have much discomfort.
Got you.
So that's one of the clues that the rotator cuff is involved. Also, patients will have more night pain. When they sleep on the affected shoulder, sometimes wake up with pain, discomfort.
It's hurting all the time.
It's hurting with sleeping and with overhead activities are basically the hallmarks.
Is it just going to be pain, or could there possibly be like inflammation in that area?
There could be clicking, there could be
clicking.
catching, there could be giving out, other mechanical symptoms that can happen along with the pain, and loss of range of motion, where you feel like the first thing that happens if you want to examine yourself to see if your shoulder rotator cuff is healthy is reach behind your back and see how far you can go on one side. And then see the other side, see how far you can go on the other side. The first thing that goes is that ability to go up behind your back and scratch up. So that's one of the last things that returns when we fix those injuries as well.
So if you're having a hard time scratching your back and you've been doing a lot of, because pickleball is such a big thing right now, right?
Exactly.
And outside of tennis and racquetball, but pickleball right now is just kind of like the craze in the nation. And here in Hawaii, and now that the weather is getting warmer, a lot of people are playing it. Probably going to start seeing a lot more of those kinds of injuries, yeah?
Yes, it's one of the more common things that we see in clinic is rotator cuff impingement, rotator cuff tendinosis, and along with that you can have slap lesions, which is the biceps attachment inside the shoulder. And the good news is that they can be easily treated one way or another and go back to normal function, normal activity level after you get those treated.
So how do you treat a rotator cuff injury? Would it require coming in to see Dr. J?
So if you have symptoms that are persistent, nagging, not going away over time, if you're having difficulty sleeping at night, waking up with pain, and if you see that your function is decreasing over time, those are kind of the indications maybe to see someone and get evaluated. In terms of treatment, the initial treatment is usually non-operative, and to try to help the patient regain the range of motion again.
Right.
So usually exercises, physical therapy, sometimes anti-inflammatory medication, sometimes we do different types of injections like PRP, or we don't use cortisone as much nowadays because it causes some long-term degenerative changes, so we try to avoid cortisone in younger patients. But those are the mainstays of treatment that are non-operative, regaining the range of motion. The main thing for the joint is to move. So when the joint becomes stiff, then there's going to be more and more discomfort.
It's not doing its job.
It's like the eye cannot see.
Right, right.
The joint cannot move, the eye cannot see, kind of similar thing, the function loss. So we try to regain that with stretching exercises, with therapy, and then with strengthening exercises. Sometimes when you strengthen those muscles, those are not the main exercises you do in the machines at the gym. They're more different exercises to strengthen the rotator cuff. You can help increase the distance between the two bones that are affected, and then that can help sometimes relieve the pain and discomfort, alleviate pain and regain function.
Well, I love that you are giving us all of the things that we can do prior to going to surgery, because surgery is always going to be a last resort. But just the fact that you have all of that information for us, especially with these types of injury, that's really, really important for us, Dr. J. So we thank you so much for being with us. And we did have a full screen up there showing you where you can get more information and how you can get a hold of Dr. J. There's his information right there. If you're starting to feel shoulder pain or any kind of pain in your joints, this is the man you want to talk story with. So Dr. J, thank you so much for hanging out with us.
Thank you for your time. I appreciate it.
We appreciate you.